afternoon, Miss Teresa.
Hi, Dr. Phipps. How you doing?
I'm doing very well. What do we got on the schedule for this afternoon?
We have Jamie coming in.
And this is going to be the pretty much what we do on a day-to-day basis, you know, classic male pattern hair loss. However, the backstory here is much deeper than that.
My name is Jamie. I am from Newton, New Hampshire. This is my home. It's a farm stable. We had a lot of...
Okay, guys. Okay.
They're great. I am a 35-year-old trans woman. I live here with my fiance, my dog, and our 4 cats. There was a book that I read as a kid. It was about a boy who kissed his elbow, and the next morning he woke up and he was a girl. And I don't know what the moral of the story was, but I spent months and months, and I must have been 6 or 7 at the time, trying to kiss my elbow so the next morning I would wake up being a girl. And that feeling persisted for a very long time. And then at 16, I started to go bald. 15, 16 years old, I started to get male pattern baldness. And at that time, I went, I'm just gonna be a guy because I'm bald and there's no bald women. So I was living as a man till I was 32. One of the hardest parts of the day is getting ready because I get to see the baldness that I've got going on in full light in front of me. For years, I didn't speak about it to anyone until it all just came to a head out of the blue. When I was 32, I was in a relationship. I had moved in with her, and my girlfriend found women's underwear in our bed. And she accused me of cheating on her. I explained to her that it wasn't what she thought it was. It was much different. Those aren't someone else's. They're mine. After I told her that I was trans, I felt absolutely nothing but relief. It was a weight that I didn't know I was carrying off of my chest. So even though I was bald, I decided I'm not dressing as a man. I'm not being a man in any situations. And I started to wear wigs every day. Immediately, I feel better about myself, just being able to look in the mirror and see someone far closer to how I see myself. Not having hair and wearing wigs, it's difficult to be able to get a firm grasp on self. I've done the hormone replacement. I've come out and started living fully as a woman. I know that there are bald women out there. It's the fact that I have male pattern baldness in the way that when you look at my hairline, it looks specifically masculine. So my goal here is to finally have my own hair, to just be able to be myself.
Are you here to see somebody about some hair?
I absolutely
Well, you're
am.
at the right place and I'm the right person. So I'm Dr. Angie Phipps.
Jamie, it's nice to meet you.
Nice to meet you too. So it's always good to put a face to a patient. So in the age of COVID, I like to meet my patients outside so I can see them before we mask up. So we're gonna head upstairs where we can examine your scalp.
Sounds great.
The world perceives men losing their hair as a natural process, and it's not anything that people question. When women lose their hair, it's something that people question, and it can be a much more of a psychological issue for women than it is for men sometimes. So when men go from male to female, it becomes super important for them to be able to establish that hair as their identity as a female.
Okay, so now I actually need to evaluate your scalp and check your donor area to see if you're even a candidate for surgery. A hair restoration procedure is essentially taking hair from the back of the head, which is the donor hair, and replacing it into the balding area.
To do a hair transplant, I will surgically remove a specimen out of the back of the head. That tissue will then be passed off to my technicians who will dissect each hair follicle individually out of that specimen. Then I will make individual incisions at the right angle, direction, and orientation that I want the hairs to grow, and then implant each follicle one by one.
All right, so what I'm gonna do now is I'm just gonna look at your donor area.
I really want to do this procedure for Jamie, but until I evaluate her donor hair area, I just don't know whether we're going to be able to do it.
come in.
Good morning, Dr. Lopez.
Good morning.
We have a patient coming in today. His name is Eric Block. He has a lipoma.
Oh, cool. I love lipomas. A lipoma is basically a benign growth, usually, of fat tissue. And some people, I mean, we all have fat, maybe some more than others, but that's okay. So everyone has fat cells, and something tells them to, hey, let's make more of us, more the better, right? They just start growing. And so lipomas can get huge, and I'm excited to see how big this thing really is.
My name is Eric Block. I'm from Florence, Alabama. I have a lipoma on the posterior of my neck. I'm gonna go see Dr. Lopez today. She's a renowned dermatologist, and I'm hoping she's going to help me with my condition. About around 2005, I think I was getting a massage, and the masseuse was like, well, you know, what is this? I didn't even notice it at the time. At that time, it was probably less than the size of a marble. Finally did go in and have it examined, and they said it may not grow anymore. Just keep an eye on it. Hi, I'm Eric Block. I'm here to see Dr. Lopez.
Okay, if you can sign in for me, please.
Okay. I was hoping it would stop growing, you know, but that didn't happen. I would say around 2008, it probably had doubled in size, but I just didn't really like going to doctors.
All right, we're going to be right in this room. Go ahead and take a seat on that green chair for me.
Okay, great. Thank you. At that point, I started growing my hair a little bit longer in the back as cover. It makes me very self-conscious. You don't know if someone's judging you, and that's disconcerting. I felt pretty isolated for a while, and so I'm ready to get some help.
Hi, hello. Is it Mr. Eric?
This is he.
This is you in the flesh. I'm Dr. Lopez. Nice to meet you.
Nice to meet you, too.
So what can we do for you?
I don't know. I have a little condition. I was hoping you might be able to help me with it.
Okay, where is it?
It's on the back of my neck.
Okay, how long have you had it?
Long time, 14 or 15 years.
15 years, okay. And what are your symptoms?
The most uncomfortable part is the sheer weight is causing neck problems. And my posture and balance are off, and I really notice it, and it's gotten a lot worse over the last year or so.
Okay, so do you mind if I take a look?
Not at all.
Okay,
That's what we're
well,
here
from
for.
here, I don't see
That's because I have
it.
huge hair, but once we move the hair, you will be able to see it. I had long hair for a long time. I mean, obviously, it helps to have it long, to hide it, but I'm really hoping if they remove the lipoma that it won't mess up my hairline. Because if I get the help I need today, I'll definitely be getting a haircut.
Oh, I see it already. Yes, my friend. Okay, let's take a look at On Its Glory. Oh, wow, that's like a melon. What I'm looking for is, one, if I'm able to help Eric in removing his large lipoma, and two, if removing the lipoma will change his hair in an unpleasant way. My only concern is it's about 25 centimeters. It is bigger than the biggest I've ever seen. The danger is not being such a big mass would require lots of lidocaine, and too much lidocaine can lead to toxicity from the lidocaine. So we may have to put him under general anesthesia to have it done, which can increase your risk of complications during the surgery. And then there's a more cosmetic concern because his hairline may be permanently altered. You have a lot of excess skin there. So the excess skin, a lot of it is underneath your hairline.
Okay.
So I think we can save a lot of your hair.
Okay.
But a lot of the skin is gonna go.
Have to go.
Yeah.
Okay. All right. You think you can
good.
do it?
Yeah, I think I can. I think I can, and I hope you don't need, general anesthesia.
I would prefer to avoid general if I can.
Yeah.
You know, I have a young daughter. It counts on me exclusively, so.
Okay, how old is your daughter?
She's about 13 and a half, going on 17. No, she's a great kid.
21.
Yeah. There's a lot at stake for me, possibly having surgery. I'm a single dad. I don't really have much help. Her mom's not really around. I'm pretty much responsible for all her care. They say life is 90% just showing up, right? So I'm just hoping I can get through the surgery without problems. I can get anxious. I mean, it doesn't happen all the time, but I can't control it if it happens. Hopefully it won't happen. But yeah, I'm having a, you know, I'm worried that it might.
Yeah, I think you're going to be fine.
Okay.
Fine.
Okay.
Yeah.
Okay,
All right, I guess that's it.
If you want to pass me the consent form, Joss, you need to sign the consent form.
I'm a little apprehensive about the surgery, but we'll see what happens.
What are you apprehensive about?
Well, just complications, infections, my own ability to deal with, you know, the stress and anxiety. So we're just gonna have to play it by ear and do the best we can.
All right. Thank you, Jocelyn.
Should I sign it in blood? I don't know.
All right.
Jamie is a transgender female who has experienced male pattern hair loss. In all other aspects of her life, she feels like she's accomplished being her true self. However, there's this one issue of hair loss looming over her bald head that she wants to see if she can address with a hair restoration procedure.
One of the constraints with you for hair transplantation is you've got a small head.
I do.
And so I can only take out a certain amount of tissue, you know, because you got a small head. So we'll see what we think that density will yield us.
Best case scenario for Jamie is I would like to be able to harvest 3,000 grafts, but just given the overall smaller size of her head, I don't know if that will be possible.
My own family members have suffered from hair loss and have underwent the procedure. So my litmus test with patients is if you're my sister or you're my cousin or you're my best friend, would I recommend a hair transplant to you? And if the answer is yes, we're gonna move forward with you. And if the answer to my family member would be no, then we're not gonna move forward with you either.
This is my one and only chance. Otherwise, it's wigs for the rest of my life. And if it's just wigs for the rest of my life, I will feel like I will never be whole. That I am always dressing up to be a person that I'm just supposed to be.
But I do consider you a very good candidate for surgery.
I am super excited.
Yay! So I tell my patients, don't look in the mirror and expect to see any hair growing for at least 6 months.
Okay.
Now here's what happens. Here's your skin. I make the little incisions and we put the hair follicles in. Now, the root of the hair follicle has been taken out of the back of your head and now it's in the front or top of your head. The root is very smart. It knows we moved it from one spot to the other. And when it detects that change in physical environment, this root's gonna get scared. And when the root gets scared, it's metabolically gonna shut down or go dormant temporarily, okay? And then when it goes dormant though, the hair that was attached to it is gonna detach and it's gonna fall out. So when you leave today after surgery, you're gonna have little tiny bristles of hair sticking out all over the place. And then in about 2 weeks to a month, all of those little hairs are gonna start to shed out and you're gonna see them in the sink and in the floor and in the drain, and don't freak out. Okay, absolutely. It's not your graft or follicle coming out. It's just the root's going dormant and the shaft is detaching from that dormant root, okay? All of the roots have been surgically implanted below the surface of the skin. The skin has healed and they're there. But now they're dormant. And the crazy thing is that the dormant phase of a hair follicle life cycle lasts for 3 to 5 months. Okay. So for 3 to 5 months after surgery, you're gonna look just like you do right now. There's not gonna be any new hair growing. Then, depending upon the length of your genetic resting phase, then the new hairs will start to grow. So in about 3 to 4 months, some of these roots are going to start to wake up and produce the new hair shaft. They're not all going to wake up at the same time and pop through the surface of the skin like a chia pet, which we don't want because that doesn't look natural, right?
Absolutely.
So the slow growing process of this adds to the naturalness of it. But in 3 months, maybe a couple of hairs come in. You look in the mirror, you can't see a couple of hairs. And then in 4 months, some more comes in. In 5 months, some more comes in. In 6 months, some more comes in. But it takes a good 6 months before hundreds and hundreds of those little hairs are starting to reemerge and grow to any length that when you look in the mirror, you can actually physically see something happening. Right. Okay? And then from 6 months to 8 months, then these hairs are coming in at a nice steady pace.
It takes a long time to get results. This is what I call a delayed gratification cosmetic procedure. Other cosmetic procedures, you go in with something not being there and you come out and it's there automatically. This is a delayed gratification procedure that you really have to hold your patient's hand and encourage them to just not be overwhelmed or discouraged with how long it takes.
Coming into all of this, my biggest fear was just straight up that it wasn't going to be able to happen, that she was going to say, you have too much loss, there's not enough that we can do for you. And now that we've gotten to this point, I just feel like I'm going to be able to just be normal. And that's all that I want.
All right, let me put some glasses on and we're gonna get started in creating the generalized shape of the hairline and then we'll get started, okay?
Absolutely.
Okay, all right.
I'm a bit anxious. I mean, just the idea of having my back of my head torn open and things shoved in the front is a little disconcerting, but I absolutely trust in her skill and put myself fully in her hands.
So you should just feel me touching you and some pressure, but nothing sharp, okay?